If you click this video away, then please tell me what the reason was so that I can improve. Otherwise, hi and welcome. I am trying to learn medicine, today appendicitis, and after we've done that, we're gonna do squat training. And if you participate in the squat training, then it's at your own risk. And this is about internal anatomy and also a bit about defecation and feces. And this is no medical advice. I'm just reading it and trying to understand it. And this is the third part, I think. So we're going now over it and trying to memorize what is written here and trying then from memory to make a presentation. Appendicitis. Inflammation of the appendix, which is around 10 centimeters long, a long blind tube arising from the beginning of a large intestine. There are two kinds of appendicitis: acute, which strikes suddenly and usually requires immediate hospital admission for an operation to remove the appendix, and also chronic, which may continue for months before an operation is necessary. Acute appendicitis. Symptoms. They may develop over 4 to 48 hours. The first sign is usually pain that comes and goes. At first it may be felt near the navel or sometimes only in the lower right side of the abdomen. First near the navel and in the lower right side of the abdomen. After a few hours there is severe, constant aching in the lower right side of the abdomen, which is tender to pressure. The pain is worse on moving and may interfere with sleep. The patient feels sick and may vomit. There is often constipation, but sometimes the bowels may be loose or normal. Food and drink are usually refused. It may hurt to walk around or to pass urine. There may have been a previous similar attack of pain that subsided. The breath may be foul-smelling. The temperature usually rises moderately up to 39 degrees Celsius. In children, high temperatures may be noted. Okay, from the symptoms, so the first thing, it is the appendix is 10 centimeters long at the beginning of a large intestine of colon. Of a large intestine, it is the colon. Of colon. And it can become inflamed, and now it starts over a few hours to 2 days, over 4 to 48 hours. First maybe some pain and then goes away, but after some time it is a severe constant pain. Firstly it can be just at the navel and a bit at the lower right side, and then the constant pain, severe constant pain at the lower right side. Severe constant aching in the lower right side of the abdomen. And may feel sick and vomit. Food and drink are refused and should also not given, as later written. Food and drink should not be given. This is no medical advice, I'm just reading it here. Food and drink should not be given. The temperature can be risen, and breath might be foul smelling and hurting to walk around. Duration. An immediate operation is usually needed, after which patients are discharged from hospital within 1 or 2 weeks and can go back to work after 3 weeks. Sometimes the pain will stop after a few hours, but patients should never delay seeking medical help if appendicitis is suspected. It can be that the pain subsides, but when the person if appendicitis is suspected, the person should seek medical attention. And if it is appendicitis, it will be removed, and after a few days, 1 to 3 weeks, the person can be released and is fit again. Causes. The open end of the appendix becomes blocked by kinking, swelling inside the walls, or by a hard mass of fecal material, and infections flares up into an abscess. It can be kinking, I don't know what that word means. It can be swelling inside of a wall, so it can be kinking, it can be swelling of the walls, and it can be hard faces which prevent it from this material. And infection flaring up when an abscess that causes. And infection flares up into an abscess. And there is no an abscess infection. The abscess may burst, spreading the inflammation all over the abdominal cavity and causing peritonitis. And that is inflammation of walls of the abdomen. Let's see, it was peritonitis. Period. Inflammation of the peritoneum, the peritoneum, peritonitis, peritoneum. Peritonitis is inflammation of the peritoneum, the membrane that lines the abdominal cavity surrounding the stomach and other soft internal organs. It can cause death in 1 to 2 days if untreated. So the peritoneum, peritonitis, peritoneum. Let the patient lie still if appendicitis is suspected. Do not give food or drink. Do not give painkillers. And basically consult the doctor. If pain has persisted for more than 4 hours, but call the doctor earlier if the pain gets worse, becomes continuous or keeps the patient awake. Diagnosis of acute appendicitis is always difficult because the symptoms are so variable, so an immediate medical opinion is essential, especially in children and the elderly. Send the patient to hospital immediately, what the doctor might do, for observation or surgery if acute appendicitis is suspected. Occasionally, if the diagnosis is in doubt or the pain has cleared, the doctor may decide to observe the patient at home. Prevention none. Outlook. With early observation leading to early diagnosis and treatment, the outlook is excellent. Recurrent attacks of acute appendicitis arise if the appendix is not removed. Chronic appendicitis. A condition in which the patient feels bouts of vague discomfort in the right lower abdomen, often for some months. Although acute appendicitis rarely develops. Often an operation is performed to see if there are other reasons for the discomfort, but rarely are any found. The appendix is usually removed and in most cases the symptoms disappear. If we say there are rarely any other found, do we mean any other than appendicitis? Or there are rarely reasons found. But if your appendix is removed, it clears up. Okay, I'm going to start the camera and translate it. Appendicitis. The appendix is around 10 centimeters long, and it is at the beginning of the large intestine, from the small intestine into the large intestinal colon. There's the appendicitis. And the walls of it can swell, or it can be blocked through hardened feces, or it can have kinking or something, and there is now an infection and an abscess. Now, and it is dangerous because it can develop into peritonitis if the abscess bursts, and that is then inflammation of the peritoneum, and that can lead untreated within a few hours to death. So, appendicitis, the symptoms are that there is at the beginning, so the symptoms develop over 4 to 48 hours. At the beginning there can be some pain near the navel or on the right lower side of the abdomen, and it can come and go a bit, and after a few hours then it is a severe aching on the lower right side of the abdomen. And the person feels sick, maybe cannot sleep, does not want to eat and should also not eat, and should not take painkillers, and there may be a foul smelling of the breath, maybe a rise in temperature, and it can also be that the pain's going away again. Now, if appendicitis is suspected, it is not so easy to find it out because the symptoms are not so clear, but if it is suspected, the person should seek immediate medical help. And then it's talked about and discussed and then looked for observation, and if appendicitis is suspected by the doctors, then it is removed in operation. After the operation, within 1 to 3 weeks, the person is released from hospital and is fit again. And it can be also chronic appendicitis. There is vague underfeeling there then over a few months or years. Often, most of the times, that does not develop into acute appendicitis, but it can. And there can be made an operation, and after that operation, removing of the appendix, the chronic appendicitis should be gone. So, acute appendicitis, pain in the lower right side of the abdomen, getting worse and continuous after within a few hours, and it should be sought medical help as soon as possible, as soon as it is suspected, because it can be life-threatening. If it is treated properly, it has a very excellent outlook. That is according to Keith Watkins Family Medical Advisor on the page 78 and 79, but this is now medical advice. I'm going to stop the camera. That was the medical part. If you were here for medicine, you can go directly to the next part of medicine. If you... it's still a video. If you stay here and participate... So if you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the squat training, then it's at your own risk. You're bringing one leg up. And the other one. Take the leg at the ankle, make a straight back, and bring the knee down to the ground. Other leg, take it at the ankle, straight back, knee down to the ground. And legs wide apart, toes are pointing in front, we're stretching the inner side of the leg. The train stop exercise. And over to the other side. And now mentors go from side to side. And now 12 squats. So just legs wide apart and down to the first one, and the second one, and third one, and the fourth one. And with number 5, and number 6 we're having a half. And 7, and 8, and 9, and 10, and 11, and 12. And now the 6-back squat squeeze. We're going down into quarter squat and press against the top part of the leg, only on one side. And on the other side. Down into half squat and press against the middle of the leg. And on the other side. Down into 3/4 squat and press close to the knee. And on the other side. And now the fastest giraffe of water pond. Down into 3/4 squat, press against the leg, go towards it, and on the other side. Press against the leg, go towards it. Again, press, go towards it, and press, go towards it, and 2 more times, press, go towards it, and again, go towards it, and up. Last exercise, the propeller, down into full squat, arms to the side, over to one side, press against the leg, look up to it. To the middle, over to the other side, press against the leg, look up to it. Middle and up. Again, one leg up, pull the leg up, point with the toes down, relax the leg. Other leg, pull the leg up, toes down, relax the leg. Take the leg again at the ankle, straight back, knee down to the ground. Number 1. And one heel onto the ground, pull the toes in. Foot to the left, pull the toes in. To the right, pull the toes in. To the middle, move the leg from left to right. Other heel onto the ground, pull the toes in. Foot to the right, pull the toes in. To the left, pull the toes in. Middle, and move the leg from left to right. And legs wide apart, we're breathing in, going down. Again, in, out, return and cross the legs, and breathe again out. That was the squat training. I thank you very much, and until next time.